I'm Neil Graham. I'm a clinical research fellow at Imperial College London, working in the Traumatic Brain Injury Research Group. The relationship between sport and dementia is not currently well understood. There are lots of differences between different sports in terms of the frequency and the severity of head injury. A lot of the work that looks at brain damage after sport, in particular a condition called chronic traumatic encephalopathy, has been done in American football players. We don't know terribly well how this relates to other conditions. Some of the earliest work looking at dementia in sports was looking at the brains of boxers, and there seems to be a relationship in certain cases between a degenerative process and repeated hits to the brain. But again, it's really not clear how common that is, and it's something that needs to be explored in a lot more detail. The impact of even more mild hits to the brain, such as heading a ball in football, I think is even more difficult to quantify, and that's why we need to do more work in this area to help understand that and give evidence-based advice to people about to what extent they should engage with sports. We know that there's a massive public health benefit to exercising frequently and engaging and staying fit, and we know that there are brain benefits to looking after your health in terms of exercise, and we wouldn't want to put people off taking up sports before I think we know more about what the relationship is. So there are two main things that really motivate me. The first is as a doctor, that we all have too much experience, unfortunately, of seeing people who are affected by dementia and how this affects individuals and their families. And I think that this is a really exciting opportunity at the moment to develop treatments which can hopefully prevent or stop the development of dementia. So that's the doctor and scientist in me. My grandmother had Alzheimer's dementia, and the personal experience of having a family member go through that journey was very profound, and I think is another strong motivator in terms of driving me to work towards trying to understand the condition more, trying to learn more about dementia, and ultimately trying to develop a treatment or cure for dementia. A lot of my time is spent working, trying to understand the meaning and significance of brain scans from people who've had head injuries. So we're looking for very subtle changes on these brain scans using some of the latest automated techniques. So this is able to show us signs of damage that can't be seen by the traditional approach of a radiologist scanning through the pictures. So we're using the latest very sensitive techniques to look for brain shrinkage, suggesting loss of cells after brain trauma. One of the really exciting findings that we found in our population of people who've had a traumatic brain injury is that they're showing very striking rates of brain shrinkage, which are similar to Alzheimer's in terms of their scale. It's a really important opportunity to have reliable tests, such as a scan that you can do to look for progressive loss of cells in the brain, because it gives us a useful target to stop. Our hope is that by understanding the changes on the scans, we might be able to use these to design trials of treatments to stop dementia, and we can use this as a marker to know whether we've been successful or not.